So good afternoon, everybody. It's great to be here. I do acknowledge that I'm standing between you guys and lunch. So I promise to be on time, but I promise to be also efficient and as interesting as I can be while I'm up here. So my name is Will. I'm with Zynerba Pharmaceuticals. It's great to be here at this conference. One of the things I like about it is that no matter what you're looking for in this macro cannabis, macro cannabinoid space, there's something here for you. And that's pretty cool. We definitely are going to be, I think, a rare bird at this particular conference in that we are a pharmaceutical company by every measure of that term. Where we fit in is that, like everybody in this room, we believe in the medicinal value and the medicinal potential of CBD. So with that as a background, I'll remind everybody that we're going to be talking about forward-looking statements here, and that there are risks and uncertainties involved in investing in biotech. If you want to take a look at our risks and uncertainties, please do check out our filings with the SEC. So, who are we? So we are a rare and near-rare neuropsychiatric-focused pharmaceutical company. So we have a deep pipeline focused on high unmet medical needs. We believe that combined these translate into multi-billion-dollar market opportunities for our primary asset called Zygel, which is a CBD transdermal gel. We'll talk about that in a minute. We have 4 clinical shots on goal, and by that I mean we're approaching 4 different indications currently with Zygel. One is Fragile X syndrome, one is autism spectrum disorder, one is 22q11.2 deletion syndrome, and the last one, certainly not the least one, is developmental and epileptic encephalopathies, or DEE for short. I saved that for last in this particular bullet because we just recently reported compelling safety and efficacy data from our exploratory phase 2 Believe 1 study in kids with DEEs. We'll talk about that in detail in a moment. We have an experienced team with the type of experience you need for this type of a company. We have development and commercialization experience in transdermal delivery, orphan drugs, rare diseases, neurology, psychiatry. So I think we have the right team in place to continue to be successful. Unlike a lot of our brethren in the small biotech world, and unfortunately for a lot of companies out there, we're well capitalized. We have a cash runway today that takes us into the second half of 2021. We have a lot of upcoming milestones as well, all near term. This is a quick snapshot of what our pipeline looks like. I won't dwell on this because we're going to go into each of these indications individually. But before we do that, let's talk a little bit about the primary asset itself. This is Zygel CBD gel. So it's very differentiated. It's the first and only patent-protected, permeation-enhanced, pharmaceutically manufactured CBD gel. And let me unpack that for you. Patent-protected, we have patents that take us out until 2038. It's also pharmaceutically manufactured. So we don't have acres upon acres of plant in our backyard from which we extract. We manufacture CBD just as we would any other drug. We manufacture it from its chemical components. CBD is CBD. So we're making CBD. It just so happens we don't pull it from plants. One of the big differentiating factors from us, from CBD gel, from Zygel, is the fact that it's transdermal. So we have a formulation that gets it through the skin and into the bloodstream. And you may be thinking, Will, CBD is kind of a tough thing to get across the skin and into the bloodstream, isn't it? And I would tell you, you are exactly right. It's hydrophobic. CBD is also lipophilic. So because of its hydrophobicity, when you rub CBD on your skin, it tends to collect there like an oil slick and not go very far. It's also lipophilic, so what does get through the skin tends to collect in the fat layer below the skin. There are a variety of ways, of course, to get around this. Some of them are more theoretical than others, but our favorite is through permeation enhancement. So we've combined our proprietary pharmaceutically manufactured CBD with a permeation enhancer. It's a GRAS-rated permeation enhancer. Kind of funny to say GRAS-rated here. A little ironic, but in this particular setting, it's actually has nothing to do with GRAS per se. It's an acronym that means generally regarded as safe. So we've combined our synthetic CBD with a GRAS-rated permeation enhancer that allows it to effectively get through the skin and into the bloodstream, and from there into the brain and the CNS, where its unique MOA takes over. As I think everyone in the room knows, CBD modulates a variety of receptors in the CNS and also a variety of pathways, including the endocannabinoid pathway, which is particularly important to all of the indications that we're pursuing at the moment. And regarding these neuropsych indications, We do have good protections as well as important designations from the FDA, including Fast Track designation and Orphan Drug designation in Fragile X syndrome. But before we get to Fragile X syndrome, let's talk about developmental and epileptic encephalopathies, because that's of recent news. So developmental and epileptic encephalopathies, DEE, it's a big term for a really problematic group of kids, a very high unmet medical need. So this is a group of rare and ultra-rare childhood onset epilepsies, impaired and regressed developmental progress, cognitive impairments, behavioral disturbances, psychiatric issues, and it's an incredibly medically fragile population of kids. So these are kids that are prone to every infection that goes around: flu, colds, respiratory tract infections. Comorbidities include respiratory infections, gait disturbances, cerebral palsy, feeding problems. So a very sick group of kids, unfortunately. And it's important to remember that in any given setting, these kids are going to have a lot of these types of events simply because they're so medically fragile. They also, unfortunately, have an awful lot of seizures. The most common and debilitating seizures that they have are either focal impaired awareness seizures, or FIAS, or convulsive seizures, which used to be called focal to bilateral tonic-clonic or generalized tonic-clonic seizures. These seizures are probably 75 to 80% of the seizures that they get. Now, we just conducted and completed an exploratory phase 2 study called the BELIEVE-1 study. We announced the results from that in just September 18th, and the results were very positive. I'll go into these in more detail, but we saw a 44% median seizure reduction in FIAS and CS seizures by month 2, and this was conserved through 6 months of study. That was through the end of the study. We also saw a greater than 42% of patients with FIAS or CS experienced a greater than 50% improvement from seizures month 2 to month 6, again, end of study. So really remarkable reductions in seizures that we're seeing. The drug was well tolerated in this study, and we also conducted qualitative assessments, which not only showed that the drug can impact seizure duration and intensity, but can also improve socio-behaviors as well as cognitive impairments. And based on the strength of these data, based on the backs of these data, we're going to be going and have a goal of meeting with the FDA in the first half of next year, the first half of 2020, to discuss these data, and to discuss the path forward in pivotal studies. Now let's take a crack at the data themselves. We'll start with safety. I mentioned that DEE are very fragile. They are just a fragile population of kids. So adverse events for them, unfortunately, are very common. Now, I know there's investors in the room and watching the webcast or watching the video that deal in biotech a lot and know what an adverse event is, but I also am sure there's people that don't understand the nomenclature that we use. So in order to explain that, let's talk a little bit about what an AE is and what an AE isn't. So an AE is any and all events that are recorded during a study. It has nothing to do with whether they're drug-related or not drug-related. They simply are any event that happens in a kid during a trial period. So this can be influenza, lower respiratory tract infection, ingrown toenails, sunburn, a scrape, status epilepticus. And status epilepticus, by the way, is a seizure that goes on for more than 5 minutes, or a series of seizures that happens in quick succession so a kid can't recover from any of those seizures. Also common in these kids. So when we're thinking about AEs, we're just thinking about events that happen, nothing that is necessarily drug-related. And so in this population of kids, you would expect to see a high rate of events, which is exactly what we saw. Most kids had an event. Importantly, in pointing to the safety of this drug, there was only one child who withdrew due to an adverse event. And maybe of more interest is serious adverse events. We only had 10 serious adverse events in this study, 10 patients with serious adverse events. Of those 10, 8 of them were deemed to be not related to study drug, leaving 2. Those 2 were deemed to be possibly related to study drug. One of them was a lower respiratory tract infection, and one was a child with status epilepticus. And as I've mentioned, both of those are common in these kids already. What's of equal interest probably is what we didn't see. One of the things that plagues oral CBD is the fact that there are concerns over gastrointestinal events, concerns over lethargy-related adverse events, and concerns over potential hepatic injury, liver injury. I'm happy to say that we saw no SAEs related to hepatic, gastrointestinal tract, or lethargy-related SAEs. So a very clean drug so far. The data in this study showed that the drug continues to be well tolerated and only continues to add to that safety database that we have for Zygel. Let's talk about the seizure reductions. Let's talk about the efficacy. These are two beautiful slides. On your left, this is the median percent reduction from baseline in seizures. So you see from month 2 onward, kids had between a 44 and 58% reduction in their median seizures every month from month 2 through end of study. 44 to 58%. As it relates to a 50% responder rate, that's the one on the right. We saw from month 2 to end of study month 6, between 42 and 63% 50% responder rates. So really exciting data for these kids, really exciting data for these families, and I think really exciting data for us and for our investors. I mentioned as well that we did a qualitative assessment at the front end of this. We basically asked parents an open question. So what did you experience in this study? What happened to your kid? What else did they see? And not only did we see that the drug improved seizure intensity and duration, it also seems to improve socio-behavioral and cognitive impacts. So we saw a 50% reported an improved vitality. So that's alertness, that's awareness, that's energy. 51% of those kids reported improvements in seizures. 57% reported improvements in cognition and concentration while they were on drug. 44% reported improved socially avoidant behaviors, and even 28% reported that they went to school more often while they were on drug. So all of these improvements are important to us for a number of reasons. It's great for the kids, it's great for the families, of course, but because of the overlap in these types of behaviors, it provides us a lot of confidence in the design of the Fragile X study, the ASD study, and the 22q study, given the fact that these overlap in all those indications. So again, based on these data, we're going to be going to the FDA and talking about these and hopefully finding a path forward into pivotal studies in the first half of 2020. And we're approaching it in an interesting way. As opposed to focusing on individual syndromes, we're going to focus on all of the syndromes and take care of their seizure types. So not focusing on syndromes, but focusing on the most common seizures these kids have. I want to switch now to Fragile X syndrome. If you don't know it, that's okay. It's a rare disease. You probably don't know it unless it impacts your family, but think about it as an acquired genetic autism spectrum disorder of the worst kind. Symptoms, which are things like social avoidance, high anxiety, are all related to deficiencies of the endocannabinoid system, and of course CBD is known to modulate the endocannabinoid system and help repair some of these symptomologies. 71,000 people, but no drugs approved. Good year for Fragile X. We've already completed a phase 2 study, which got us into the ongoing phase 3 pivotal study. We just recently had a patent issued that extends our patents to 2038 here. We presented those phase 2 data. This was a 3-month study in the JND that was published in the JND just recently. We presented 12-month data, so we allowed kids in the 3-month study to roll into a long-term open-label study after they completed study in the FABC phase 2 study. We can now track how those kids do long-term compared to how they did after 3 months. And that's what this shows. So this is the ABCC Fragile X. This is how we're measuring those behaviors, measuring the improvements in behaviors on the ongoing pivotal study as we did in the phase 2 study. The social avoidance, irritability, socially unresponsive, et cetera, those are the subscales of the ABCC FXS. In the dark green bars, you see how the kids did after 3 months on study. The light green bars are how they did after 12 months on study. So for example, the circled one, that's our primary endpoint in the ongoing pivotal study. After only 3 months, those kids were better by almost 58%. 58% improvements in their behaviors, these core behaviors of Fragile X. That improved to 77% by 12 months. And you can see a similar thing in every one of these subscales of the ABCFXS. We are in a pivotal study. Primary endpoint is that change from baseline to end of treatment in the ABC social avoidance subscale. Secondary endpoints include the irritability subscale and the socially unresponsive subscale. It's all aligned with the voice of the patient guidance from the FDA, and we have top-line results expected in the first half of 2020. Again, the first half of 2020. ASD, this is one we probably know a whole lot more about. There's probably not a person in this room or listening that doesn't know someone or have a family member who's impacted by ASD. It's a near-rare disorder. So between the ages of 3 and 17, there's about something just under 1 million patients here in the US. And the symptoms are similar to that we saw with Fragile X. High anxiety, social issues, social behavior patterns, deficits in verbal and non-communication. It's just a really detrimental diagnosis for a kid and their family. And it's significant. It's diagnosed a lot more these days, but there's still only 2 drugs approved for ASD. Both of them are atypical antipsychotics. As a result, they carry a pretty rough side effect profile. And neither of those are approved to address that core social impairment and anxiety that these kids have. The good news is that there's good reason to believe that CBD may work well in ASD. Newer studies suggest that ASD is related to a disruption in that endocannabinoid system. As we discussed already, CBD may modulate that endocannabinoid system to help improve some of these behaviors. We just recently got a patent directed toward methods of treating ASD with our CBD that takes protection in ASD out to 2038. And we've initiated a phase 2 study. We're calling it the BRIGHT study. Studies in 36 patients with ASD between the ages of 3 and 17. And once again, we expect to have top-line results from this study in the first half of next year, the first half of 2020. So far, first half of 2020. Meet with the FDA about DEE, pivotal data from Fragile X, as well as phase 2 data from the ASD study. And here's the punchline, we're not done yet. 22q 11.2 deletion syndrome. So this is one we probably don't know a lot about, unless you have a family member with 22q, or you're a huge fan of Saquon Barkley from Penn State and the New York Giants. He's actually raising money and raising awareness of 22q. Good guy to have on your team in that regard. It's known amongst the advocacy organizations that deal with families with 22q as the most common rare disorder that you've never heard of. There's 81,000 patients here in the US. That's about the same size as Down syndrome, and yet it's a pretty well unknown manifestation. And it does manifest in two different ways. Physically, it's a midline condition, so these kids are born with malformities that go straight down the middle. Nose, think about it in terms of cleft palate, throat, breathing issues, lungs, heart, stomach, right down the middle. They spend the first couple years of their life in and out of the emergency room getting those midline conditions corrected surgically, and they do well. The problem is, of course, those surgeries don't impact the other way that this disease manifests. So this disease also manifests with pretty rough, really brutal neuropsychiatric illnesses, particularly ASD-like disorders and profound anxiety and learning disabilities. And the problem for these kids is not only is it impactful in the first few years of life while they're kids, it's also really impactful as they grow up, because this leads to profound long-term issues, including that these kids have a 25-fold increased risk of developing schizophrenia than anyone in this room, than anyone without 22q. 25-fold higher risk. Good reason to believe here again that there's biological relevance for CBD in 22q. Of course, the fact that CBD acts as a modulator of the endocannabinoid system is super important in this setting as well, but it also helps modulate as an agonist against serotonin 1A receptors and an antagonist against GPR55 receptors, so all are included in the way that this might impact these neuropsychiatric behaviors in 22q. There's great belief that by early control of this profound anxiety, we may be able to delay the onset of psychoses or prevent the onset of those long-term psychoses, like that profound schizophrenia that happens 25-fold more times than it does to you and me. We've initiated a phase 2 study. This is a smaller study. It's a 20-patient study. It's called the INSPIRE study, based on the fact that these kids are awfully inspirational and get us to work every day. It's in pediatric patients and adolescent patients with 22q. And yet again, we expect to have those results available in the first half of next year, the first half of 2020. So again, stacking up to be a really interesting first half of the year. Pivotal data from Fragile X, meeting with the FDA about DEE data to develop and determine that pivotal path forward. And then also data sets, top-line data sets available from the ASD study as well as the INSPIRE 22q phase 2 study. The good news, I think, is that not only do we have all of these interesting milestones, reason to believe in the biologic relevance of CBD, and also a proprietary CBD molecule, we also are a financially sound company. We have a clean balance sheet. We have no debt. We have 23.2 million shares outstanding as of August. As of the end of the second quarter, now we haven't reported the third quarter yet. We'll do so in early to mid-November. But as of the second quarter, we have 88.7 million. And in addition to that, an incremental $7 to $9 million coming in over the next 18 to 24 months from an advanced overseas finding. All in all, those cash are sufficient to fund our operations and capital requirements into the second half of 2021 as I stand here today. So that's beyond the milestones we've talked about. That's beyond the expected NDA submission and potential approval of Fragile X if we get the data we want to see in that ongoing pivotal study. And just with the last couple of seconds, this is a quick view of our milestones. We did a lot in 2019. We achieved the milestones we wanted to achieve in 2019. We believe that sets us up for a lot of momentum as we head into 2020. A lot happening in the first half of 2020, but a lot happening throughout the year. And of course, as we're doing all of this, we're going to continue to scan the horizons of rare and near-rare neuropsychiatric indications to identify other indications that may be of worth to pursuing with Zygel, our proprietary CBD. And with that, I am out of time. I'm happy maybe I can open this up to a question or two, and then let's go eat. And if you don't have any questions for me, we can certainly meet in the hallway, and we can do this in person. But are there any questions? Yes, sir.
Okay, so on the, what is the, I guess, the pitfalls or trials of dealing with the medical side
Mm-hmm.
versus what you're doing holistic, I guess, kind of with the CBD?
Yep. So, yeah.
And encouraging that they're kind of starting.
That's a great question. Yeah. So the question that just came forth is how do we think about the fact that we're developing CBD in a more pharmaceutical methodology as opposed to being a more consumer methodology, right? So we're in a very good position right now, and that's a terrific question and very timely. The FDA has thus far been really clear about their requirements, and if the previous speaker before me just mentioned that, right? And all the work that they're doing, the great work that they have going on right now, they're not going to be able to have an indication. They're not going to be able to necessarily say that their drug works for anxiety or for X, Y, and Z. The FDA has been very clear about the fact that if you want to have CBD on the market with an indication, with a label that says it does something, it cures, it impacts, it prevents, then you have to go through the clinical trial process, including a pivotal study, to prove safety and efficacy and to determine that label. And so we're simply going about developing CBD as if it were any other drug. We're following the prescribed pathways that the FDA has out there for us. So at the moment, certainly the FDA's regulatory framework helps us an awful lot. But frankly, we've been doing this from day one. It's good that they've said what they've said. But like I said at the beginning, we're pharmaceutical guys. This is how you develop drugs. So that's a terrific question and a very timely one. That doesn't at all minimize what's going on in the consumer world, but it is two different opinions and two different ways of developing assets. It's a great question. Anything else? Yes, sir.
How is this drug administered, and have you looked at different modalities?
Great question. So his question is, how is the drug administered, and have we looked at different modalities? Another good question. So it is administered transdermally. So if you think about this like the Fragile X study, it's being done in kids between the ages of 3 years old and 17. So their parent, it comes in packets, like individual doses come in little packets, almost like the size of a packet that you get from McDonald's. But of course, they don't say ketchup, they say Zygel. The parent will squeeze it into their gloved hand, and they'll rub it on the arm of their child twice a day, once in the morning, once at night. And it effectively gets through the skin, it's the upper arm, effectively gets through the skin and into the bloodstream that way. Now, I wouldn't say that we're looking at different modalities, but what we are certainly considering is different ways to potentially administer it as we think about life cycle extension. So we've been asked a few times about, instead of having little packets, could you have a pump? Certainly a possibility. And we'll continue, once we get the drug on the market, knock on wood, we'll continue to do exactly that. It's a good question. Yes, ma'am.
Simple question. I want to make sure you get your card so I can tell you what we have to hear from the FDA and see if there is a role that we might play together.
I would
If there is a role that we may be able to play together. I think this may be synergistic with our scientific working group.
Let's swap cards, for sure.
Okay,
I look forward
great.
to that. Anything else? Thank you guys for listening. I appreciate you letting me cut into your lunchtime.